Do you have any medical conditions? No. So, no diabetes? Nope, no diabetes. What medications are you on? Metformin for my diabetes. Every single time? I can't help but facepalm. A woman came into the ER with a wound on the back of her head. I asked, "Miss X, can you tell me what happened?" "I'm not sure. I got some chicken at the gas station, went to bed, and noticed I was bleeding this morning. While inspecting the wound, I saw it was quite deep, with some strange cotton-like material embedded in it, tracking too far to see clearly. My instincts started kicking in, so I probed further." "Were you attacked? Did something hit you? Were you in an accident? Could something have fallen on you?" "No, I just went to bed. Maybe I got up in the middle of the night to use the bathroom." Still puzzled, I sent her for a CT scan, the donut of truth, before trying to explore further with a scalpel. The results? A bullet lodged against her skull. As for the cotton, I suspect the gun fired through fabric. When I informed her she had a bullet in her head, she casually replied, "Oh, weird," and went back to playing Candy Crush on her phone. I asked a patient if he'd ever had surgery, and he said no. During a CT scan of his abdomen, we noticed he only had one kidney and clear signs of surgical scarring. Curious, I returned to ask him about it. He started sweating and winking, claiming he had no idea what happened to his kidney. Later, I approached him when he was alone, and he confessed he sold his kidney to pay off a massive gambling debt. A woman came into the ER complaining of vaginal discomfort and discharge. During the pelvic exam, we found a severe yeast infection, but also noticed a foreign object. "Is there something stuck inside?" "No, I don't think so. I'm not sure what's in there." Upon further examination with the speculum, we discovered a peeled mandarin orange, soft and intact. "Oh, that. We'd heard it might boost fertility." You truly can't make this stuff up. A man faked being paralyzed after a lumbar puncture. A nurse called to report that the patient couldn't move his legs following the procedure. I contacted the team that had performed it, and they confirmed no issues during the procedure, but agreed with my plan to order an urgent MRI. When I examined him, the nurse mentioned she thought she saw him move a foot. Moments later, he said he could move his legs again, but claimed they felt strange. That strange sensation quickly turned into severe pain, and he began requesting intravenous narcotics like Dilaudid. I refused, as his story didn't make sense. By some miracle, this man walked himself right out of the hospital after I denied him the IV meds. Oh, and the MRI results? Completely normal. I haven't had sex in 5 years. A woman actively in labor in the emergency department. I'm not a doctor or surgeon, but work as an anesthesia/OR nurse. A mother blatantly lied to us about her 12-year-old child before an ENT procedure. As part of the pre-surgery routine, we confirm details with the patient and their guardian. Name, age/date of birth, medical history, current medications and those taken in the past 24 hours, procedure being performed, when they last ate or drank. When answered the last question, the mom insisted he hasn't eaten anything since yesterday. The child backed her up. The surgery went smoothly with no issues. However, when it was time to remove the tube, the child vomited a massive amount of rice and beans, easily over a kilogram. Despite our best efforts, he aspirated some of it, requiring a bronchoscopy and intense suctioning. Thankfully, he survived without complications and fully recovered in 2 days. When confronted about the lie and told her son could have died, the mum defended herself. What was I supposed to do? He was hungry, and he eats like a bull. Who am I to stop him? Our patience was gone at that point. You're his mother. He nearly died because of this. Takeaway: always follow pre-surgery fasting rules and be honest with your healthcare team. Honestly, the silliest lies are from people who misrepresent how much they drink or use drugs. Alcohol and benzodiazepine withdrawal can be life-threatening, and if you're using street opioids, your tolerance is likely higher, meaning you may need more medication while hospitalized. Just be honest. I don't care about how much you use. I only want to ensure you don't worsen from something we can prepare for and prevent. When I worked as a pediatric nurse, I encountered a particularly trashy mother who brought her 2-year-old daughter in, claiming the child wasn't eating or drinking. We admitted the baby, growing increasingly concerned because food trays were untouched, there were no wet diapers, and the child refused her juice. Yet, her weight stayed the same. The pediatrician asked me to observe discreetly, so I positioned myself outside the room, peeking through a cracked window shade. To my disbelief, I watched the mum forcing pizza and soda into the baby, who clearly had no appetite for the chicken and mashed potatoes on her tray because she was full of junk food. The mother even changed the baby's diapers and hid them instead of leaving them for monitoring. It was surreal. She denied everything, even after I confronted her with what I saw. Poor kid.